Hi everybody, I'm back in Eugene and wanted to give you an update about how we're handling things at the practice now that we have a shelter and stay-at-home order from the governor. Many of my colleagues in primary care have decided better part of valor is to convert our practices to telemedicine ports so we can still maintain a connection and still essentially offer you visits that would be for routine follow-up, medication adjustments, and issues that a lot of times we would meet in the office, but now because of the restrictions, we really want to put safety obviously first and foremost for all of us. As a individual solo practitioner, it's been near impossible to get testing kits for the SARS virus. And as a result, because I do not have personal protection equipment that is required to do the testing in the office, we've essentially decided to make those testings off-site. What I wanted to put this video together was to make sure that you knew that there was an opportunity to still make what would be considered now virtual appointments, which have always been around, but obviously now with the current pandemic situation, have been a go-to for a lot of my fellow family physicians. The way it works is simply the way a typical visit would run. Making an appointment with my front desk staff would be the same as usual. You would just identify yourself and tell them that a telemedicine visit would be appropriate. The platform I'm currently using requires a phone number, so if when you make the appointment, my front desk staff knows to make sure to have a phone number where I can reach you. You'll get a link forwarded to you by text or email. We've been doing this with text and it's worked very well. You'll be invited into, essentially it's a virtual lobby, and in the order that I see folks, you'll be invited into the virtual exam room, and we carry on a conversation, interview, and basically a standard medical visit. It's all HIPAA protected and recorded, so the information is safe. The idea is to maintain flow, and so we don't have this feeling like folks can't continue their primary health needs if medications need to be adjusted, if we need to go over labs, pretty much a lot of things that we do in the office. There will be some delays for the immediate future for annual wellness visits that Medicare requires. There are stipulations that I think we're going to put that off until May, or possibly even longer, depending on how things go. So you will also be getting for those of you who are in my patient practice as we speak, you'll be soon getting an email describing this, and I'm also putting information on the website. So mostly I wanted to make sure that you knew that telemedicine at my office was available. It's up and running, and so far the folks I've had on the telemedicine portal, it's worked out very well, and so far so good. Hope you guys are all staying safe and sane. I've been trying to put some updates and reminders just about self-care, getting enough sleep, good nutrition. As a colleague's friend of mine on the web the other day, he said if we start freaking out now and getting ourselves into a panic mode, it's probably not going to do us well for the long haul. So as in with long distance running, this is kind of for the long haul. Take care of yourself every day. Do something every day for rest and rejuvenation as much as you can. Get out for a walk, even if it's just for a short one, and be mindful of some of the supplements that I mentioned earlier. It seems like high dose vitamin C, zinc, warm liquids frequently certainly aren't going to hurt, but I think right now social distancing is going to be the number one practice and approach that we're all doing what we can to maintain. So I hope this finds you well, safe and protected with you and your family. Any questions, obviously contact my office, and we will be in touch. Take care, everybody. Talk to you soon. Bye.